Good afternoon. My name is Larry Forsyth. Welcome to the webinar provided by ACCI and Australian Business Consulting and Solutions, and also funded by the Federal Education Department. I'm Larry Forsyth. I'm the Senior Manager for WHS and HR Consulting with Australian Business Consulting and Solutions. Today I wanted to go through three subject matter with you based on the aged care strategies and improving capabilities. The first one is around improving recruitment and employee engagement, then strategies for staff retention, and then improving WHS capabilities. And so for this webinar, we'll specifically be focusing on the aged care sector. My experience in the aged care sector, probably not as long as some of you that are viewing in today, but around about 6 to 7 years, where I've worked in private and public health, also for aged care, and then also in the Department of Communities, Housing and Child Safety. In those roles, I undertook HR-specific short and long-term contracts, so I am somewhat aware of some of the issues in this sector. And so, therefore, the funding that's provided this webinar for you today has enabled me to share some of that information, research and stats with you based on the development of this program. I know that you have provided your email address, and that's fantastic, as part of the webinar registration. So we will be sending you, after the webinar, a whole list of resources, templates, processes and checklists that you can use in your workplace. You can use those straight away. You might want to sort of tweak them to customize them to your business, but they're there and supported by this initiative. So again, welcome. So from a staff turnover perspective, and what we're seeing through our research and organisationally, and this may not be necessarily new information to you, but there's reasons why people actually leave their jobs, and we're seeing that people, and the turnover within aged care sector is high as well. So it can be from a lack of promotional opportunity, in that it's about that someone has to leave before someone is promoted. It can also be a poor relationship with the manager as such. There's a little bit of a cliche that says that people will leave a manager before they'll leave the organisation, and so it's very important that you engage and have those strong relationships with your people and obviously with your managers. And it can be that it's not as well paid in aged care as it might be in the private health sector. And so some of my experience is that people will come on board in aged care until they find that job in the private health sector or public health sector. And so therefore we're in positions as HR people that are working in these fields that we're bringing people in, we're training them, we're recruiting them initially, which costs money and time. We're training them, and then they turn around and leave, and it could be 3, 6, 12 months later. So it is very expensive. In the aged care industry, some of the issues, you've got resident aggression, and recently there was a piece in the Australian newspaper I saw, I think it was only last week, we saw some of that, and it's not necessarily just around that this happens normally. Aged care residents obviously have are unwell, are sick, dementia, etc. We're seeing that wages of registered nurses in residential aged care is less, or 10% less than acute care nursing, and particularly in rural areas it can be up to 12 to 13% less. So our research says that there's a bit of a role conflict, and so due to the increase in HR and admin support, many RNs dealing with excessive paperwork and not necessarily clinical issues are finding it very difficult to actually balance some of those aged care issues. From a workforce planning perspective, some of those issues are that the turnover rate, and as I said, in the aged care sector is up 25%, and it is higher in some other sectors. So what we've got is situations where you're trying to bring people on into your business. How do you look after them? How do you care for them, nurture them? Very sort of client-centered. But then there's also these higher training costs for services due to the training new staff as a result of that staff turnover. It's been said that it can cost upwards of $30,000 to $50,000 to actually recruit, bring on board, train someone, and then they turn around and go somewhere else. So it can be quite frustrating. And so some of this information is going to be able to support you in making your workplaces more productive and sustainable, or I hope it will anyway. Other workforce planning issues, well, staff need to be adequately trained, and absolutely, and they need to be trained in order to deliver high quality care to their residents. And in that way, the delivery of high quality care to residents is a significant factor in employee retention. My experience is that people have said to me, you know, I didn't get an induction, I didn't get the training, and we know that when times are tough and the economy is scarce with training funds and HR funds, well, they're sometimes some of the first things to go. So how do you keep that momentum going around training your people? Some of those competitive recruitment strategies, you may or may not have some of these in place, but obviously it's very important to induct your people. And so from the very beginning, make sure that, or I would be suggesting, and based on my experience, that the induction process is one of the first things that you really might need to focus your time and energy on. I've had employees say to me in the past with inductions that I've developed and run myself, gee whiz, you know, that was the best induction I've ever had. And when I've asked them about that, you know, based on versus somewhere else, I have employees that have said to me, well, in fact, I actually never went through an induction. So I would really rate the induction process is significantly important. In that way, through that induction process, it starts to demonstrate very strong communication, and it also supports better selection processes. And so how do you do that? Through behavioural questioning, through instruments that you might use, and I wouldn't suggest that they would be a standalone instrument as part of that recruitment. And then it's about how do you do that? Do you have panels? Well, these things take time as well. But when that employee starts to see from the very beginning your organisation and how they're doing it in a best practice way, that's going to create some of the momentum around employment and culture. So in the aged care sector, due to the many and complex issues already discussed or highlighted, as well as the above points, additional strategies are needed to assist with recruitment staff into the industry. So some of the following strategies are quite big picture, but they're based on research from state and federal government perspective. So from a job description perspective, and employees have said to me in the past, and I would be always recommending that each employee or role has a job description. So people have said to me before, well, I don't actually or never have had a job description. Well, why are they important? Well, from a recruitment perspective, it's important so that the applicant knows and understands the job role, and in that way it creates a bit of a baseline for their accountability. It's also important from a learning and development perspective, and I would always be suggesting that when you think of the employment life cycle, so employing people, or even before you start to sort of recruit, it's about how you advertise, so that we see a really strong cycle. We see strong missions and value statements and behaviour statements from the organisation, and that links all the way through to performance appraisals and learning and development frameworks, and so matching what needs to be done in the workplace with that learning and development plan. I'd be suggesting 8 to 12 tasks is the ideal number to write into the job description. Strategically, we may see a few less, but operationally it's important, again, as I said, so that people can actually see and they can be reminded around their job role. If you don't have a job description, well, what does that look like? Well, it's very difficult for the person to properly commit or to be held accountable for the role. One of the resources that we will provide you, as I mentioned earlier, is actually a job description, and you can use that as a template. You could tweak that accordingly, but it is something there for you as a best practice item. So if you don't have a job description, it can be hard to performance manage an employee without one. Thinking about interviewing and selection techniques, well, I may be preaching to the converted with you as my audience. There's obviously stages to the recruitment, and so sourcing candidates and how you advertise and what you do now. So thinking about the different methods that you could actually employ. And then screening potential applicants using the tests and or interviews that I mentioned earlier. And from that perspective, bringing people on board and ensuring that they're able to actually fulfill their new role effectively. We use internally a great instrument that we also share with our clients as well as part of what we do at the Chamber and Australian Business Consulting Solutions. And so what we try to do is match that instrument or recruitment instrument with the position description. So that's just another strategy that we like to put in place based on the linkage of bringing people in the right way and doing it in a best practice format. So sourcing candidates, well, we're certainly aware of social networks these days. Most people have 3 or 4 identities through social networks. And so it greatly improves that reach right out sort of across the world, and it won't necessarily be new information for you. So in that way, we can start to informally look at a particular candidate or candidates as such. We're seeing the great phenomenon of gamification now, and we're seeing that BMW, also the Navy, and in fact some of the global hotel chains are setting gamification up on their websites where people can actually register to say that they'd be interested in undertaking that test, and for that organisation then to see that person and how they might perform on that particular website. And if they perform well through that sort of competency assessment, be it the gamification, which is the recruitment strategy, then the organisation will come back and invite them to apply further. So in that way, it can be informally done, and it's a great strategy. So if you're interested, search gamification. So from a sourcing candidate perspective, you can then view the skill sets, basically what people have on their social networks, and you can contact them easily ahead of the competition who may not use social networks. So that's certainly a step ahead if you're not looking in that way. What we're seeing based on our research up to 2013, that LinkedIn really was sort of the highest percentage where people are putting up information around what they do and how they do it and where they've been. And then we've got the other social elements there, or network frameworks too. So quite high in that sense. So don't just go necessarily for your current strategy. Look at thinking outside the square and looking in a broader way. So when you're screening potential candidates, obviously the interview is important. So you want to create a set of verbal and non-verbal questions and interactions and how people meet from the very beginning. So first impressions really do count. And in that way, focus on gathering information to decide on which course of action that you'll take. And it might mean that you need to talk to your clinical nurses, residential aged care nurses around that. So consultation is very good because the people on the ground really have some very good ideas too, and that's about being more innovative and how you do that and how you screen your people. Some of those types of interviews are obviously the phone call. Myself, actually, I do a lot of sort of Skype interviewing and working online in that way. It doesn't mean to say that's the only way, but it is another medium, particularly in that you're trying to bring people in from sort of the regions to perhaps a city location or vice versa. Obviously, the face-to-face interview, as I said, the video conferencing calling, and then the group interviews. Some of my past experience is that the group interview actually works very well, and in that way you can source a larger number of candidates, and so that can also be very productive and another way or strategy to put in place. And it also helps identify how individual candidates respond to a team environment as well. Some of those interviewing techniques, so obviously open questions are good, where you want people to actually tell you the story about what they've been doing and how they might do it in your organisation. You want to give case study or set up case studies, hypotheticals, real scenarios, as well as part of that interview process, and in that way it can provide an opportunity for the candidate to give real life examples. So they may give the right answer, but that doesn't mean that you'll choose them for that particular role. It's very important that you bring the right person on for the right role, and so you want to make sure that you link some strong questioning around that. So from an onboarding perspective, from the very beginning, day one, what we do as part of our consulting, develop induction programs, handbooks, policies and procedures from a health and safety and HR perspective, but it's important to introduce the new starter to the team members. And that's really the start of their induction. So that means a walk around to meet people, to get them used to the environment, housekeeping, those sorts of things. So I know that one of my colleagues recently had moved from consulting into the banking sector, and a very large organization. And so the first week was really just sort of onboarding, meeting new people, and they didn't even get the technology sort of up and running until the second week because there was so much to do before that point in time. So it can be different for different people, but it's about flexibility and agility and how you could make it work for all parties. In that way, you want to ease them into the culture around the workplace, and obviously things like dress and uniforms, smoking areas or non-smoking areas, and of course information about policies and procedures is vital too. And in that way, you're really setting it up from the very beginning. And as I said earlier, people have said to me, well, what induction? I've never had one before. Gee whiz, that's the best induction I've ever had. And so it's something that I strive for personally, and it certainly demonstrates good best practice. From a performance management perspective, well, the Fair Work Ombudsman believes that employers who establish effective performance management systems, recruitment systems, induction systems, and processes can reap significant benefits from a happy, motivated, and better performing workforce. And so you don't want to be in a position where you don't bring that person on in the best possible way that you can, and then for them to make a complaint later on down the track where they say they haven't been trained, haven't been inducted, they've been treated unfairly, because we know that in that sense it won't create that happy, motivated and best performing workforce. So in that if that employee was to complain under the Fair Work Commission or to the Ombudsman, you need to have evidence around what you have put in place. And of course, those best practice strategies need to be filed and reported and recorded and reported back and as part of your sort of HR filing. Thinking about performance, well, I think this is sort of pretty straightforward, but it's effective. Performance management creates a harmonious and productive and, of course, happy and motivated workplace. And this is beneficial for both employees and employers. And so the bottom line is that people don't normally come to work to do a bad job. They come to work, yes, to pay mortgages, to have social interaction, and for a number of reasons. But people mainly come to work to do a good job. And so this is around what performance is. Some of that good performance elements are things like that its duties or performs the duties of the position and performs them to the standard required of that role and of the organisation. Its compliance with the workplace policies, rules and procedures, standards, codes of practice, and it's particularly important to think about your code of conduct. So if you don't have one, I would be highly recommending that one is designed and implemented in your workplace. Obviously, acceptable behaviour in the workplace, safe behaviour. People want to come to work safe and they want to go home safe. We're seeing that from a health and safety perspective, it's very, very important to have a safe environment, and that there are evacuation drills that take place, that people know where the fire exits are. All of those sorts of things are particularly important to people, more so than they ever used to be. In that way, it demonstrates positive behaviour, and this impacts on co-workers as well and on the organisation as a whole. And the bottom line there is that the worker gets the job done to the satisfaction of the employer. And in that way, all parties are happy. Yes, there are ups and downs in work life, but again, as managers and supervisors, it's about how you support your people and how resilient you are. Some reasons for underperformance, it could be around that there's no feedback on the employee's performance from the manager. There's a mismatch between employees' capabilities and the job expectations, and we're hoping that from the very beginning you can ensure that there is a match. Sometimes employees lack skills and knowledge for the job, and some of what I'm hearing from the live shows that we're running with this initiative in New South Wales is that sometimes people coming into aged care are coming in because they can't get a job anywhere else. They're not qualified. They've got very low skills in that way. And some aged care organisations don't have a choice, and they have to take them on because they need people to do the job. Well, with those people, they can certainly be trained. So it's about how much time that you can put to those particular people. And so in that way, if you are going to employ people with lower skills and knowledge, it's about that obviously you need to spend more time with them and train them up. Some of those other reasons around underperformance can be that there could be very low morale in your organisation. The culture may not be sort of adjusted and aligned. And so there also might be some personal issues around family, drug, alcohol issues, things like that. And we're seeing particularly in workplaces, mental health issues more prominently these days than ever before. So it's very, very important in that way that you've got relevant policies and procedures in place, and that people know where to go, what to do, and how to do it, and what their accountability is around that. Also, in that if you've got people that are underperforming, there can be some cultural misunderstandings around that. So we would always be suggesting that you run cultural awareness training as well in support, and we're seeing this particularly important in aged care and right across the health sector, to tell you the truth. And there might also be some bullying that might be happening in a particular workplace. So thinking about the law that changed and the legislation change on the 1st of January as such last year, we're running workplace bullying programs nationally as well. So there's a fine line between what's bullying and what isn't bullying. And in that way, managers and supervisors need to be aware of that. So one of our handouts, common performance issues, will be provided to those of you that have provided us with your email address. So look out for that. From a performance management perspective, so what is best practice? Well, we would always be suggesting that obviously you want to plan what that person is doing. So plan performance is important, and in that way people know again what they're doing, where they're going, who to report to, and so it really guides people and creates a path for high-level performance. And in that way, people start to improve their performance. Again, there can be ups and downs in workplaces and organizational life, but in that way, by providing a plan, then people can improve and continuously improve. In support of that, it can be developing people, so learning and development. So if you've got plan performance, you create improved performance, and in that way you can plan and enable people to develop from a learning perspective. It's also about problem solving, and in that way, I don't know about you, but as a manager, I like people to, yes, okay, if they have to come to me with a problem, but also to come with a solution. And so creating a culture around that too, because you don't want to be in a position where people just come to you with all of their problems and you're the one to sort of put that fire out all of the time. So how you are as a manager, what sort of style you have, and the way that you give feedback to your people and support them to problem solve and to be autonomous when they can be, is a great way to go. And then out of all of that, some of the best practices around career planning. I know that in my own work and in past work, that we want to support our people to have a good career, to move on if they want to, and that's their choice. But to support people around that, and so it might be that in the aged care sector, we're seeing nurses may move up into sort of nurse manager roles, and so to support them around that learning. And so if you plan and improve and help them to problem solve, then obviously they're increasing their competencies and capabilities, and that's all about best practice, and that's what people want in the workplace as well. So from a best practice model perspective, you can ensure that you have the facts and that you're not making judgments too harshly. You can cite examples of poor performance if you're giving feedback around that, and so I would always be recommending and suggesting to people that they keep good records around those things, keep good notes. I don't know about you, but we're wearing sort of 3 and 4 hats these days, and so work is very challenging and busy, and so it's important to keep good records around sort of people's performance too. And in that way, be precise, be selective in what you say and how you say it. So obviously a tone of voice, body language, those sorts of things are very important too, as you provide that feedback, as you demonstrate your empathy, your social competence and your awareness as well. So it's incredible. We really have to be, well, it sounds like superhuman, but in fact it's the way of leadership these days. So to be emotionally intelligent, resilient, and to have some theory behind you, but obviously to be delivering good best practice from a personal perspective at the coalface and on the ground is so important. So when you're speaking with your employees, I'd be suggesting you use calm, open language and open discussion. Keep the questions open-ended and reinforce positive things the employee does well. It's also important to acknowledge their strengths, so what they do well, how they can improve, and to support them around those things too. Obviously, micromanagement doesn't always work, but you might be in a position where you do need to micromanage. Thinking about that 80-20 rule, and I've seen it happen before, and managers certainly speak to me around that from different organisations, where they may have to spend 80% of the time with the problem employee or the person not performing, and 20% of the time with the person that is performing. So it doesn't seem fair. So it's a difficult one, and so there needs to be a balance. So by implementing a best practice model around performance, it ensures the employee is aware of the specific tasks of their job. And in this way, it's shown to enable them to perform better in their roles. And it also enables you to understand the gap between what they've been doing and what they need to do. So it also enables them to start to identify that too as part of where they want to go and what they've been doing. So that real sort of open communication and discussion is obviously very, very important. I have managers and directors and CEOs and also different people in past life and in this current role where people will say to me, how can I actually create better performance in my organisation and for the people that I manage? And I really believe it's about communication. It can be a different organisation, but communication is so important. Thinking about communication and feedback in positions where you are providing feedback, giving feedback, and my question here might be, or is I should say, why don't people give feedback? I don't know about you, but most people, we're all human, we like to receive feedback, but there may be situations where we're afraid to receive that feedback, that you don't ask for it often enough, and that people sometimes actually don't even know how to give feedback. So if you are giving feedback and receiving feedback, you want to create some empathy about this situation that the person wants to unload on you or share with you some of that information. And so how do you do that? Obviously it's through your body language, and it's about listening to people. And so particularly from an emotional intelligence perspective, empathy is highly important. And so how do you demonstrate empathy when you're receiving feedback or giving feedback? You want to be brief with the feedback as well. Talking about it for too long, people don't really listen that well all of the time. And so most people can only take on so much at a particular time. Be patient with people as well. I think breathing and staying calm, and I mentioned that before, is obviously important, and be sensitive to people's needs around what's going on for them in their workplace. Obviously you still need to manage and you need to be assertive and directive, but these elements are very important from a behavioural perspective. So based on past behaviour, it's about that person performing in the role, and it's about their performance. It's not about the person. So it's about that you separate those things, separate the person and separate the performance. So how are they doing in their role, and give them feedback about that performance. Try to be specific, and that's why I mentioned before having very good records and notes around those sorts of things. You don't want to generalize, and you don't want to compare to others. So make sure you've got some good file notes there. And don't assume. You want to get the information correct. And again, if you haven't got those files and records and you can't refer to them, then it can leave a very big void, in that if you say, when you did this, when you didn't do that, and the employee will say, or possibly say, well, when did that happen? And if you haven't got the day and the time and what actually happened as part of your recordings, then it leaves you with a bit of a gap there. So try to record as best you can. So when you're meeting with the employee to undertake that performance review or appraisal and to give them feedback, you want the employee to explain the situation. You want to be able to resolve disagreements. You also want to plan together for the future. So what are the next steps? And to get some agreement around those steps and those goals, you want to clarify the details exactly. Some employees will need a lot more detail than others. And again, it's about recording that information. And, it's about that people can read those things too if it needs to be written down, and you need to make it sort of quite formal. Obviously, you want to remain calm and relaxed and encouraging. And if you're a person that doesn't demonstrate that, or you find that difficult, well, then it is around mindfulness. It's about practicing those things. It can be around meditation. So you too have to have some strategies in place around your work-life balance. So how are you looking after yourself so that you can support your people? You might have a situation in your environment where you need an interpreter, so arrange for that. And don't use jargon if it's not part of the everyday workplace language. For example, KPIs. People won't know what that means and you'll need to explain it. The workforce and the workplace is made up of copious amounts of acronyms, and not everyone knows them all of the time. I certainly don't. So make sure you use sort of really common language. Talk about the issue, not necessarily the person. As I said, it's about the performance. And then from that point, it's about summarizing the meeting. Check for their understanding, look for that body language, shake hands, have a written agreement, but to get their agreement. So in that way, you can go back to them if it's still not happening and say, it happened on Tuesday at 11 o'clock, we agreed to do this and it's still not happening. And then you can take it to the next level. In your performance appraisals and at that time, so as I mentioned, don't discuss personalities, don't skirt around criticism. So if that employee wants to give you feedback, it's not always easy to get that or to receive that feedback. I have a little bit of a strategy for myself where it doesn't mean to say that I always agree, and I'm very happy to negotiate, to have challenging feedback and to work on that. But a simple thank you, whether it's constructive, negative feedback, is a good way to go because it enables you to think about and reflect on that feedback and then to create strategies for yourself, whether it's about going back to that employee or actually that you need to change what you do. And then don't compare to others. So, for example, well, the job that you're doing is not as good as what Jim does, and the way that he does it doesn't do well with employees. And so it's about how that person's performing. You don't want to nitpick, and so in that way, you might be in a position where you're micromanaging, but you want to be very, very clear about that. And so you don't want to be in a position where you're picking on them for absolutely every tiny thing. So think about that. And don't bring up unrelated issues that had been resolved previously. So there might have been a situation. You don't want to mount the situation. And so if someone's not performing around a particular task, you don't want to bring it up as part of that discussion around, well, and you never did the last three things either. That is your responsibility as it is theirs. So in that way, you need to all move on. So I would be focusing on one or two things at a time and trying to progress and improve those as you move through. Thinking about termination of employment and from a Fair Work perspective, well, circumstances must not be harsh, unjust or unreasonable. And so fair treatment is always very, very important. So that's another good reason for implementing a performance management system. People have said to me, managers, people that I've worked with and in our past organizational life, that performance reviews haven't taken place. People have talked about them, we've developed them, but we've actually never implemented them. And so if someone is terminated unfairly, unjustly or unreasonably, and they do decide to take it further from a legal perspective, then you will need to have evidence that you've actually put it in place and not just talked about it. So thinking about small business, there are some special arrangements there from a termination perspective. And employees must have worked for the business for 12 months to make an unfair dismissal claim. Thinking about learning and development, and so from a technical perspective, you're putting in place, or you're probably putting in place some technical training pretty much all day, every week, every month, etc. But it's also important too that your people have, or your managers and supervisors have leadership training, supervisory training, and even communication courses. We run a program dealing with difficult situations. There are a number of them out there, but this people management type learning and development is particularly important. We're also coaching managers and supervisors, and even running quality customer service programs. So that sort of subject matter never goes away, and it must be ongoing to enable that balance of technical and non-technical learning. Suggestions to improve learning and development. Well, in support of those deliveries, it creates a positive work environment. You can really seek some contributions from other staff. Recently I had an employee come to a program for around customer service and delivering quality, and they said to me, you know, I don't know why I'm here. I've been in the industry for 30 years. I've always delivered customer service and I've done it well. Well, the person attended the program. It was only a short program to just reinforce some elements around how you provide and give good customer service and the reasons for that. And after the session, the employee came to me and said, you know, that was really the best course that I'd been to for some time, and gee whiz, I'm still learning. And apologised for the outburst at the very beginning, which I didn't take personally. But again, it's about ongoing learning. You want to promote flexible rostering for study time around learning and development too, and you might be in a position where you can actually offer some financial assistance to cover costs there too. So in the end, you want to promote a variety of learning and development courses, and particularly consider online courses. E-learning enables greater flexibility. One of our or parts of our organisation, Australian Business Learning Institute, have some great online courses that have just been released. So if you're looking for something like that, have a search, email me, I can give you some information around that too. Moving now into work health and safety, and this is really the responsibility of everyone, of every worker, and that means volunteers, apprentices, contractors, full-time, part-time. So under the new WHS Act, there are responsibilities. So the person conducting a business or undertaking, and we refer to them as the PCBU, they have ultimately the greatest responsibility. Also officers, they can be directors, people that are on boards, CEOs, etc. So they're classified as officers, and they also have a responsibility as part of their due diligence and reasonable practicability in workplaces. And then, as I said, workers, employees, contractors and subcontractors, and others, including volunteers, apprentices. So everyone has a responsibility for work health and safety, and that is the law. Some of those duties of the officer, so it can be any person who can make or participate in making decisions that affect the whole or a substantial part of the business or the corporation, is actually an officer. And in that way, officers have been identified. So I'd be saying to you, who are the officers within your organisation who make those decisions and participate in those decisions, and they should be aware of their roles. Some of those health and safety responsibilities by workers, so employees, contractors, etc., they must take reasonable care of health and safety. They must be consulted. I still go in and out of organisations these days where people don't have sign-in, sign-out books at their front counter. Now that's not always easy for everyone as part of the practice, but you know, those sorts of simple things so that you know who's on site and who isn't. It's also important that you conduct consultation with these workers and that they follow instruction so far as that they are reasonably able to follow that instruction. So we're seeing very robust and rigorous processes and policies now in terms of contractors. And so a question is, your current contractor, have you got their information on file? Are they still certified? Have you got copies of their insurances? How does it work in your organisation? And in that way, they must follow the instructions and they must cooperate with reasonable notified policies and procedures. It doesn't mean to say that every contractor has to read every policy you've got, but it's about how you process it within your work environment so those people are safe and that you know those people are doing the job and that they're certified to do it. Thinking about the PCBU, so they must ensure that so far as reasonably practicable, the health and safety of work is engaged or caused to be engaged by the organisation are safe in that work environment. So your business is probably the PCBU I should say, and your officers are the directors, people on the board, chairmen, those sorts of things. So in that way, everyone needs to know what their role is. Workers whose activities are carried out or working or influenced or are directed by a person, or also the PCBU. So while the persons are at work in the business or undertaking business within that role, then they are the worker, but the PCBU is certainly in charge of those, in charge of those people, and it's in charge of their health and safety. And so that's about having really strong policies and procedures in place. It's having process in place, due diligence around that, and people know how to do a risk assessment, for example. People know how to access hazard forms, that those forms are being filled in appropriately. The idea is, from a health and safety perspective, that you want hazard identification to increase, and in that way incidents will be decreased. And so what is your health and safety culture? Other persons from a PCBU perspective are not put at risk from the work carried out as part of that conduct or the business or the undertaking. And so again, the PCBU has a very large role there. If you don't have good health and safety in place, well, the effects directly impact the quality of resident care, and it can have a negative impact on staff engagement as well. And so this can create lower morale, lower productivity, lower sustainability. It doesn't develop the culture very strongly at all. And then what you may or may not start to see is higher absenteeism, staff turnover, and we're almost back to where we started. So in that way, you're seeing higher costs and more time spent on recruitment and training. So again, it's about really focusing on your health and safety from a legal perspective, and having a really strong framework in place. How you implement your policy and your training? Well, the question is, what sort of framework do you have in place for implementing those sorts of things, health and safety? And so safety starts with the appropriate policies and procedures. Our wonderful product, HR Advance, that we use and many organisations purchase from us, we have over 200 customised legally compliant documents, policies, templates, and so those policies and procedures can be designed, customised for your organisation. Yes, policies and procedures, not everyone reads them, but it's very important to have them in place and to use them as your baseline, particularly from a health and safety perspective. And then from a consultation perspective, effective workplace consultation and risk management strategies are essential as part of your implementation of your program. So people know how to do risk assessments. I'd be suggesting that your managers and your supervisors are trained around that they follow due diligence in that way, and that they understand and are aware of how to apply these things in the workplace. Implementation, well, it's obviously the process of putting the decision, the policy into effect, and how you do that, how you communicate that. I would be suggesting that right from the very beginning, as part of your induction, that people become aware and you raise their awareness around that the policies are in place, particularly from a manual handling perspective. And I would take it that all of your organisations have a no-lift policy in place, and so are people actually following due process around that? And then procedures and training are part of that implementation process. So again, from the very beginning, how you induct, how you train, how it's ongoing, and that you have competencies and you record that as part of your learning and development matrix and those filings. Thinking about training, well, it is required by law, and it puts you into a better position. When you pull a program together, it demonstrates the desired behaviour. It enables you to instruct, inform, coach, and guide your people. And this is what people want out of training. They want to know what needs to be done and where. Yes, sometimes you'll get that naysayer that thinks that they come or they don't need to come to the training. But generally, people enjoy training, and it's about how dynamic and interactive you make it as well. And so I think that particularly is important, that you have good training and development in place, and that people know what to do and where and how it can be applied. And so if you need to coach your people around what needs to be done, we're seeing a lot more coaching happening with managers and supervisors these days, and how they actually communicate with their people and coach them through the process. Consultation, particularly important from a health and safety perspective. Well, why? Well, the law requires organisations to set up mechanisms for this. It's about that you can't make unilateral decisions on these sorts of things. Consultation is particularly important. So ask your people what they think as well. It doesn't mean to say what they say will be the end result. It's about how you do it together. How do you do it? Well, through health and safety representatives, through your safety committees, and or any other agreed arrangements. For example, toolbox talks, staff meetings. So we deliver and facilitate health and safety committee training. It's a very popular request. We support organisations to put health and safety committees together, and we see that as particularly important as part of the consultation process. Risk management, again, and I've mentioned that a couple of times through the webinar, it's about that you can identify the hazards, and some of those hazards or examples are listed below. And so how do you manage those? Do people actually know that they need to review these things, evaluate, monitor as part of that continuous improvement cycle? Thinking about hazards, so some of those specific hazards relevant to the aged care sector, particularly manual tasks, psychological issues, and of course resident aggression, and I had mentioned dementia earlier, and so it's about managing those particular things too. And psychological hazards, the Act defines health as both physical and psychological, and so it's about the duty that one needs to put in place to ensure, as far as reasonably practicable, that health and safety extends to ensuring the emotional and mental health of workers too. So some of those stats that are coming out, 1 in 5 Australian workers has a mental health issue, and there's millions of dollars spent on that annually. And so if your people don't know how to identify mental health within their own staffing environments, then I'm also happy to field an email from you around that. We've been running mental health awareness sessions for organisations nationally as well. So we support you with a really easy model around that. So it's particularly important, particularly that it's very prevalent in Australian workplaces. Some of those causes of psychological hazards, there's 3 broad categories. So it can be position related from a work environment perspective. It can be the tight time frames, the high output, where, as I said earlier, we're wearing sort of 2, 3, 4 hats these days. It can also be that people are working alone, late shifts, overnight. There can be some isolation. Role ambiguity, so people don't know what they're doing and how they're doing it. So from a position description perspective, you need to have one so people know what they need to do when. And it can be from insufficient feedback. They just aren't receiving it. They don't know how they're going. There's no performance appraisals. There's no check-in. It can happen in workplaces, but people like these things. Without these things, though, people can actually have some issues, and so therefore they can elevate. Some of those preventing psychological claims, so be aware of these sorts of elements of burnout. Make sure you've got policies and procedures. You want to make sure that you deal and manage with the effects of aggression in your workplaces, and I know that does happen. You want to provide team and management support, for example, team discussions and problem solving. So getting together and making sure you have those team meetings. Sometimes it's not necessarily a high priority, but it's about how you communicate and engage with your people. You also want to be able to provide access to debriefing and counselling services too. So if you don't have those in place, then it's something that you need to think about. Employee assistance programs are very, very important. And you also want to be able to carry out ongoing monitoring and review of aggressive incidents. And so that recording and reporting is particularly important. And the bottom line is that you need to get sleep, exercise, and eat well, and look after yourself. This supports psychological issues in the workplace, or not having those. So how do you know that staff are getting the message? Well, it's about some of the measurements of a success. Some of those most urgent hazards, have they been addressed? Have they been reported? Is there feedback part of that cycle? Also about the number of hazards that are being reported. So I've had managers and organisations say, oh, we don't have many hazards here, but sometimes there's not the culture of that, and people don't know how to, where to, and why it's important. And so therefore some organisations think, oh, well, if we don't have hazards reported, that means we haven't got any. But I'd be suggesting you think about that, and you might want to survey some of that. So in that way, you want employees to be involved in workplace inspections, and that's also a measure of success. And in that way, you can increase employee participation, also in problem solving, enabling them to identify some solutions to the hazard as well, and obviously following your hierarchy of control around those sorts of things too, administration, PPE, those sorts of elements. And what that does is it increases the level of interest and involvement of staff, and through that, when you survey your people, to ask them, how are they measuring health and safety? What do they think about it? What are they doing about it? You're going to get much more positive responses than you may have in the past. So monitoring and auditing these systems, you want to look at your lead indicators. These demonstrate improvement, and your lag indicators demonstrate failure or negative outcomes. So of course, you want to have more lead indicators that are reported and demonstrated, and some of those lag indicators, be it past incidents, hazards, and how you've turned those around, how you've addressed those, so that people are actually improving, changing, and the organisation is being more productive in that way too. So improving health and safety productivity, also recruitment, also performance management, how you engage with your people. You need to measure these things, and in that way you can measure and report. You can report back to your senior people, your boards, and in this way it supports your business case for more funding if that's what's required. You don't want training, learning development, recruitment strategies, induction processes to fall down and to decrease in how they currently exist, and so it needs to be addressed and measured, and so this supports sustainability and increases productivity gains. It's certainly my experience, and it's one that I would be recommending to you overall. So what we've covered is, I suppose, strategically, some recruitment and employee engagement strategies about how you bring your people on board from the very beginning, how you advertise, how you appraise your people, how you look after them, how you retain your people and train them is obviously very, very important too. So strategies in place around that. And then some of your work health and safety capabilities and how you manage those risk assessments, hazards, incident reporting, recruitment and induction around those sorts of things too, so that people know what they're doing, how to do it, how to improve, and this supports very sustainable and productive work environments. So in that way, as I said, we will be providing you with some great resources. We'll be sending these out to you. I'm online if you need to ask a question, but I'd like to thank you for registering and viewing today. I hope you've learned one new thing, or that you can take away one new thing and implement it in your workplace, and I wish you luck for the future. So thank you again for viewing. Over and out from me, and hopefully we'll touch base later on down the track. Thank you and good afternoon.